So we have a 32-year-old woman who presents to the emergency department with dysuria, back pain, and fever for 2 days. She indicates she has had urinary tract infections in the past, but never this severe. She denies other past medical history and does not take any medications. Vital signs show a heart rate of 114, blood pressure 132 over 80, respiratory rate 16, temperature 102.2 Fahrenheit. Examination shows a moderately ill appearing woman with right costovertebral angle tenderness. What test or tests are required in making an appropriate diagnosis in this patient? All right, so this is relatively straightforward. We need to identify the appropriate diagnosis here. And what are the key takeaways from the vignette? First of all, it's pretty clear that this patient has a urinary tract infection. She complains of dysuria and some back pain. You could have a simple cystitis could certainly cause some referred pain into the back and flank. But the key findings here, the reveal, is that this patient has fever, which is a sign of systemic infection, and right costovertebral angle tenderness. So this looks like a urinary tract infection with dysuria and back pain, but it's more than just a simple cystitis because she has fever and right costovertebral angle tenderness. We see here that she is febrile, but the blood pressure is still stable. And she's a little tachycardic, which is going to be from the elevated temperature here and possibly some mild dehydration, but we have no evidence of that on the vignette. So if we look at the answer choices, it's what is the appropriate diagnosis here? And what we have is, let's go through these. Let's start with answer choice B. We have urinalysis and contrast enhanced CT scan of the abdomen and pelvis. And what you see here is we essentially have B and C are similar. One's a contrast enhanced and one's a non-contrast enhanced. So if we look at answer choice B, this is something. If the urinalysis will identify the urinary tract infection, and in contrast enhanced CT scan, that's, I start thinking when you use contrast, possibly an abscess, right? Or some type of vascular abnormality or lesion. In this case, we have a woman who's otherwise normal appearing and doesn't have any significant comorbidities. She hasn't been treated in the past for this recently. So using contrast in the CT scan in this patient, looking for an abscess or renal parenchymal disease, such as, significant or advanced infection, isn't appropriate at this time. And as far as the same thing, but without contrast, right, this would be more consistent with an obstructive process that you'd be concerned of. Urinalysis would identify possibly urinary tract infection or blood, and non-contrast CT scan could look for things like hydronephrosis and obstruction or a stone. So B and C, we're going to cross out B and C here and don't think that they're the right answer. Then let's go to urinalysis and ultrasound of the renal parenchyma. So again, very similar, a lot of overlap here. Urinalysis is will show the urinary tract infection, but do we need an ultrasound of the renal parenchyma at this case? This is maybe debatable, but we're looking for an abscess here or an obstructive process. I think if this was the patient's second visit for the similar presentation and she was already on a regimen for this presentation, D may be the right answer. But I do not think we need to go and get any specific imaging in this case. And so that leaves us with choice A, urinalysis. Urinalysis is to say, hey, this patient has maybe leukesterase, maybe nitrites, and it's consistent with a urinary tract infection. I would also say that in addition to a urinalysis, after that is obtained, and I would likely obtain also a urine culture just to guide antibiotic therapy here. So let's just go with A, make sure that that is the correct answer. And indeed it is. The patient's diagnosis is acute pyelonephritis. It needs to be treated with antibiotics. And otherwise, we can make that diagnosis both with a urinalysis and also with her clinical presentation. Hey everyone, before you go, if you're interested in your own QBank, whether you are an MD or DO, a PA, or an MP, simply go to roshreview.com and sign up for a free trial. See if Rosh Review's content is right for you. Keep learning, keep working hard, and always have a sense of mission about your work. Now is your time. This is Dr. Adam Rosh signing off.